Good morning. My name is Homer Bryson, and I'm the Director of the Georgia Emergency Management and Homeland Security Agency. At GEMA, we continue to work with our vendors, state partners, private partners, and volunteer organizations to provide the necessary resources for Georgia's response to the COVID-19 pandemic. As of today, the public health state of emergency has been ongoing for 125 days and is the longest emergency activation in the state in memory. To streamline delivery operations, we recently established a partnership with UPS to ship PPE directly to our customers. By leveraging their existing logistical and distribution networks, we can distribute supplies faster and free up personnel to prepare Georgia for any other emergency. This is especially important as hurricane season began in June. UPS has delivered 3 mailing system terminals to the Department of Public Health warehouse and trained state employees to operate the systems. During this transition period, approximately 850 packages of PPE, testing materials, and decontamination foggers were distributed to over 200 entities. That's about a 4-day period. Medical facilities and nursing homes request resources through the Department of Public Health Ready Op system, and local governments and critical infrastructure partners request resources through GEMA's Web EOC portal. To date, the state has processed more than 26,470 resource requests. Approximately 80% of those requests are related to PPE, and we have delivered PPE to over 2,700 entities in the state of Georgia. To put that number in perspective, during Hurricane Michael, GEMA processed 1,051 resource requests. As part of completing these requests, Georgia has distributed approximately 7.9 million N95 masks, 9.3 million surgical masks, 2.7 million gowns, 24 million gloves, 485,000 Tyvek coverall suits, 1.3 million face shields, and 172 ventilators. To keep Georgia moving forward, GEMA is fulfilling requests from critical infrastructure essential workers. To date, over 2.1 million face masks were delivered to transportation, energy, telecommunications, government, water, wastewater, and food processing sectors throughout the state. Over 1 million cloth masks were provided to over 40 counties for public distribution in hotspot areas. This brings the total to more than 3.1 million cloth face masks to protect the citizens of Georgia. Additionally, 10,000 no-contact infrared thermometers were distributed to 16 local emergency management agencies that were identified by public health as having the greatest need. GEMA continues to support the Georgia Department of Education in their efforts to help safely reopen schools. We have already coordinated the distribution of 2 million cloth masks and 3,000 non-contact infrared thermometers. A second distribution to schools will include 100,000 clear masks for deaf and hard of hearing students and teachers, 1.5 million youth-size cloth masks, 1 million 3-ply disposable masks, 16,000 reloadable no-touch hand sanitizing stations, 290,000 gallons of sanitizing gel, 62,400 packs of sanitizing wipes, 50,000 face shields, and 15,000 isolation gowns. In addition, at the direction of the governor, we are procuring 3,000 decontamination foggers and 12,000 gallons of solution to be distributed to the schools in addition to the PPE listed. To address the concern of medical bed space and in coordination with the governor, we have an 80-bed facility on standby in Milledgeville and are in the process of standing up a 120-bed facility at the Georgia World Congress Center. Each facility will be ready to receive patients if the need arises. In addition, we have 4 temporary medical pods located at Phoebe Putney Hospital in Albany, Floyd Medical Center in Rome, Navicent Medical Center in Macon, and the Northeast Georgia Medical Center in Gainesville. In total, these pods provide an additional 88 medical beds to supplement hospital capacity. Making all of this happen has required incredible effort on the part of all of our employees and state partners, and I wanted to take a moment to acknowledge their countless hours and hard work spent working to keep our citizens safe. And we remain focused, and we recognize that what we do daily affects the safety and the lives of our citizens. And with that, I'll turn the podium over to Commissioner Frank Berry, Department of Community Health.